All right. So in obstetrics, you are looking at another component this morning, and this is auscultation in obstetrics. Auscultation in obstetrics. Of course, auscultation, I'm trying to actually get some sounds. Okay. So I can use a stethoscope, I can use a Pinard horn. Okay. I can even use ultrasound. Okay. So auscultation in obstetrics, of course, obstetrics is for women that are pregnant, right? So you just have to do it. You are listening to the baby's heart sounds. That's the most important thing that they are trying to auscultate in what? Obstetrics. So typically, you can use a stethoscope, just like I was telling you guys. The Pinard horn, I'll do a separate video on that. Then Doppler device, okay, ultrasound, So key aspect of obstetrics auscultation is the main purpose is to monitor baby's heart, then dictate if the heartbeat is too fast or too slow. Okay. Then also that can help you now assess if this baby is stressed out or the baby is doing well. So techniques, just like we're talking about Pinard horn, everybody else should know what Pinard. If you don't know what is Pinard horn, please just comment, right? I'll explain it to you. Doppler ultrasound, then electronic fetal monitoring. It's also another thing there. Okay. So procedure, you locate the fetal back. So from the abdomen, you do all those Leopold maneuvers. So you place the device over the fetal heart. You count the beats for about 1 minute. Then you can repeat, just for you to get the right stuff. So clinical significance, acceleration is often reassuring. If it is decelerating, that's when we're usually was disturbed. Okay, so that's it for auscultation.